so that we can share it out with folks who are here and then who are unable to be here. We do have some people at the Roundhouse, we have some people at the rally, and so I've had a few requests of folks who weren't able to join us today, but definitely want to be part of this. Okay. We just still have some folks joining us here, so I just want to make time to get everyone in the room. Very excited. Okay. Sam, I'm going to go ahead and make you co-host, if that's okay, just for the moment. Okay. Let's get started, everybody. So welcome to today. Welcome to February 3rd. Today is our doula Q&A for our Medicaid reimbursement. I am going to go ahead and share my screen because we have a presentation for you. And if I sound like I'm pausing, it's because we just still have a bunch of people joining the room, which is really wonderful. So maybe just before I get started sharing the screen, if you all want to just take a minute to scroll through here, we've got, like I said, over 100 doulas who signed up for today's conversation. So look around and see your community, the community of doula providers.
Thank you.
So exciting. And then if everyone would just go ahead and mute yourselves, that would be helpful as we kind of move forward. If there are questions that you have, for those of you who are new and just joining us, you can feel free to put them in the chat. It's a little hard for me to navigate the chat as I'm doing the presentation, so there will be time at the end for question and answer. And I'm hoping that the presentation answers a lot of the questions that you already have. So let's see. I'm going to go ahead and start sharing our screen. Okay. Can everybody see my screen? I see Mariana. Mariana, give me a thumbs up if you see my screen. Awesome. Thank you. So like I said, welcome everybody. Today is our Q&A for the Doula Certification for Medicaid Reimbursement. My name is Jessica Lujan. I am the Doula Program Coordinator for New Mexico's doulas. I would love to invite you all to just introduce yourselves in the chat. So please share your name, pronouns, your location, and what kind of doula work you are providing. We'd love to just see who is in the room, what areas of the state are representing. And well, I go ahead and introduce myself a little bit more. So I am a full spectrum doula. I worked for many years as the program coordinator for Table Women United's reproductive justice program. I've been doing doula work for, I guess, 17 years now. So I'm really excited to kind of be on this end of the spectrum and really doing a lot of support to help our doulas across the state and help our new doulas get started and initiated into this work. I have a couple of colleagues with me here today, and I'd like to give them the opportunity to introduce themselves as well. I'm going to go ahead and start with Sam, if you'd like.
Awesome. Good morning, everybody. Can you hear me?
We hear you.
Thank you all for joining. My name is Sam Peinado. I am with the Department of Health here in Santa Fe. I am the Family Health Bureau Chief. I am also the Acting Maternal Health Program Manager, which the doula program will be under this program, the Maternal Health Program. I look forward to working with you all, and this is exciting. Thank you all for joining.
Thank you, Sam. I think, is Kathy here with us today?
Kathy will not be on today.
Okay. And Chrissy, are you on with us today? Are you able to introduce yourself?
If I can figure out how to unmute myself. Hi, all. My name's Chrissy Cooper-Schmidt. I am the staff manager in the Benefits and Reimbursement Bureau for Medicaid. And I also have some other staff here, if that's okay to introduce.
Please.
And I have Chris that is on the call, and I also have April that is joining. Would you guys like to introduce yourselves?
Sure. Good morning, everyone. Chris Bartz, registered nurse. I am the nurse auditor for the Quality Bureau in the Medical Assistance Division at the Healthcare Authority.
Hello, everybody. My name is April Neri, and I am the registered nurse and reproductive health lead here in New Mexico at BRB.
Thank you, everyone, for taking a moment to bring yourself into this space. I'm excited that we have our Department of Health, our Medicaid office here with us today to help answer questions. And I see all of you starting to introduce yourselves in the chat, so please feel free to keep that up. Keep bringing yourself into this space. We'd love to have you here.
Jessica, I think we also have Janice on from Department of Health.
Oh, awesome. Janice, do you want to take a minute to introduce yourself? I'm not sure she's able to. Sam, do you want to, if she's not able to, just give a little blurb?
Okay, that's good. Dr. Janice Gonzalez. She is a Center Director of Safe and Healthy Communities here at Department of Health.
Thank you. And we do still have some folks joining us. So we are at 67 doulas today, which is really exciting. So I'm going to go ahead and get us started here. I want to take a minute just to bring us back through some history here. Today, like I said, is this launch of our program here, and launch of our website, the applications to get you all certified to become Medicaid reimbursed doulas. This work has been a long time in coming. So when I first started these conversations, it was back in 2015, and Table Women United, Young Women United, which is now Bold Futures, and Breath of My Heart Birthplace initiated some conversations around doula Medicaid reimbursement. And in 2015, this was kind of the beginning, right? All of the states are starting to bring this new benefit around, and we just didn't feel like we had quite enough information. So we did a lot of research. We did a lot of learning together about, what was best practices, what kind of living wage did doulas need in order to make this work really feasible for themselves and their families. And, it kind of kept going. And then in 2021, the conversation came back on, and there was so many amazing community advocates, community doulas, organizations that worked so hard along with our Department of Health and our Medicaid offices to make sure that this benefit has come to be. So these are just some of the names of the folks who have worked together to create this opportunity for us here today. So if we can, just send them some love, maybe through your emojis, through your chat, just giving some thanks and gratitude, because as I said, this has been a long time in coming, and it's taken a lot of work, a lot of effort, so many conversations, so much advocacy to have this come to be. So thank you to everyone here. Thank you to those folks who are behind the scenes to make sure that all of this happens as well. So let's just start with the basics, right? I know that most of us here are doulas, but there are a few folks who are doula curious. So let's just talk about what a doula is. So a doula is a trained non-medical professional who provides services which includes things like health education, advocacy, physical, emotional, spiritual support to folks across the reproductive spectrum. So this includes preconception, pregnancy, childbirth, the postpartum period, regardless of what the birth outcome is. And there's lots of benefits of doula care that we know about, right? We know that it lowers birth, it includes like fewer low birth weight babies. It lowers the rates of cesarean births. It increases lactation rates. We know that people who birth and have doulas present or who have reproductive experiences with doulas present have higher satisfaction rates. We also know that doulas can help reduce the impacts of racism and racial bias in healthcare for people of color, and that we all kind of provide this culturally appropriate, individually tailored care for folks. So just a welcome to those of you who are still entering the space and entering the room. Now, Medicaid coverage of doula support has been recognized as, a best practice. It helps to improve maternal and infant health outcomes. It improves all of the things, right? Health equity. It reduces the current levels of health spending. There's been lots of states. I think we're at 21 states right now across the country who have enacted legislation or who are in the process of implementing statewide coverage for doula care through Medicaid. And now New Mexico is one of them. So New Mexico Medicaid will, doulas can now enroll in New Mexico Medicaid to become reimbursed for their services. There are some steps which we're going to go over today and how to do that. So I'm grateful that you all are here so you can hear the steps to begin enrolling. So in New Mexico Medicaid, the services that are going to be included for doulas are doula birth services. So this includes prenatal and postpartum, physical, emotional, and evidence-based education support, as well as, linkages to community-based resources. It includes non-medical labor and delivery support. And then there's some more doula services that are included, such as counseling related to preconception, pregnancy loss, infant loss, and termination of pregnancy. So we really are covering the full spectrum of services here through the New Mexico Medicaid. I want to make a little note. So down here at the bottom, we see a note that says that prior authorization is not required. What this means is that there is no prior authorization for doulas to enroll with the MCOs. However, in order for a client to begin receiving doula services, they do need a referral from their primary healthcare providers. So whether that's their doctor, their midwife, their nurse midwife, they do need that referral for doula services. So please remember that. I just want to give some general information about our program. So the New Mexico Department of Health is going to be certifying doulas in order for them to become enrolled. So doulas will first certify with the New Mexico Department of Health, then they will enroll with Medicaid. In order for doulas to certify with the NMDOH, there are a few things to keep in mind. So first question that we have is there going to be a fee for the application? We're kind of rolling this program out in a couple of phases. So this first phase is going to take place between February 2nd, or today, February 3rd, through June 30th, 2025. There is no fee required for anybody who certifies between now and June 30th, 2025. So for the next few months, you're able to put your application in without any kind of fee. After July 1st, we will have an application fee for those folks who are applying to get certified. Just letting some more folks in here in the room. For those people who do not have internet access and who want to be able to certify through paper applications, we do have applications available for pickup at the office here in Santa Fe. This is the Colgate building, and the address is 2040 South Pacheco Street, Santa Fe, New Mexico. We can also mail out applications if people want to give a call at 505-231-6817. So this is a good option for people who do not have access to the internet. Doulas do not have to be a New Mexico resident to be certified. So for any doula who lives within 100 miles, within the states 100 miles of the New Mexico border, they are eligible to apply for enrollment. So this is our Arizona, Colorado, Utah, Texas, doulas within 100 miles are able to apply for certification. And We had a question with one of our folks who registered today, and they were asking if the information in the application is going to be available in other languages. And we want to just let you know that we will have other language options, Spanish language speaking options in the future phases of the program. Between now and June 30th, applicants will not have to complete a background check. However, background checks will be implemented after July 1st for any new application. So this is going to include people who are applying for the first time and then people who are reapplying for renewal. And there will be more information about background checks on our Department of Health doula webpage. So doulas are subject to auditing. So it's really important that when you're providing your services, you're maintaining clear, up-to-date records that substantiate the claims that you've submitted for payment. I know that the New Mexico Doula Association has been working hard on their EMR system, so definitely connect with them if that's something you're interested in. But if you're going to be, kind of maintaining your own records, just make sure that you're doing this in order to reduce any kind of risk of delay and any other future financial penalties. It's also really important to maintain client confidentiality. So again, this is not only in regards to your services, but in regards to your records management as well. So let's talk about the pathways towards Medicaid reimbursement. Everyone's going to kind of start out with some sort of doula training or work experience. The next step would be to certify with the New Mexico Department of Health. After you receive your approval for certification, you will register for your NPI registration number. The next step after that is going to be to enroll with New Mexico Medicaid as a provider. And there is sort of this side situation where you're going to also be credentialing with the managed care organizations. So those are the MCOs, our insurance companies. Once you've enrolled as a Medicaid provider and you've credentialed with the MCOs, you're able to then provide services and submit for billing and receive Medicaid reimbursement. And I'm going to kind of go through these steps a little bit more in detail. So let's talk about how to become a certified doula with the New Mexico Department of Health. The first thing that you're going to do is access your application. So again, if you need to access a paper application, you can come over to the Colgate building here in Santa Fe. If you're going to access it online, the webpage is up. You can search on the internet for the New Mexico Department of Health doula program. It's going to fall under the Maternal Health Program. So you see a little screenshot here of what our doula program looks like. It's going to have a space for any kind of forms, which is going to include your applications. We've created a toolkit, which is going to take you on a step-by-step process, which includes links to help you get certified. And then we have a list of frequently asked questions. So just a little bit more information for people who need to have a little bit more information. All right, so in order to become certified with the Department of Health, every doula has to complete the following criteria. And if you're not muted, if you all can just make sure that your mics are muted, it'll help to keep some of the background noise down. So every doula has to be at least 18 years old at the time that your application is submitted. We're requesting a copy of your driver's license or state-issued identification card that's issued within the 50 United States or the District of Columbia. You'll need to provide us with your Federal Employee Identification number, so your FEIN number. This is something that's, you can receive through the IRS. You will need to have a local business license, a tax certificate, and a permit for any city or county where the business activities are conducted. You'll have to complete a W-9 form, provide proof of current adult or infant cardiopulmonary resuscitation or CPR certification from the American Red Cross or American Heart Association. You'll have to provide attestation that you've completed a HIPAA training, and we've kind of identified a HIPAA training, but if there's a different one that you've already completed, that will, that will work. And then again, after July 1st, you will have to complete a background check. So this is same for everybody, regardless of, which pathway you're going to be choosing. And we have all of this information listed on the application and in the toolkit. The next step you're going to do is choose your certification pathway. So there are three options for you to choose from. The first one is to certify with an identified doula training. Pathway 2 is to complete a doula training that meets the requirements for core competencies and provides attestation of the completion of services to 3 doula clients. And then pathway 3 is to provide 3 letters of recommendation attesting to the competency of the applicant's skills and experience as a doula, and to provide attestation of the completion of services to 3 doula clients. So you have 3 different options, and I'm going to go a little bit more in depth on each one of those. So pathway number 1, the certified doula pathway. This pathway is for any doula who has completed training and certified with the following doula training organizations. So we've got BIABOMIA, the International Center for Traditional Childbirth, which is ICTC, and or the Shafia Monroe Consulting, Birthing Project USA, Our Earth Full Spectrum Birth and Postpartum Attendant Program, Kappa Doula Training, Pro Doula, Common Sense Childbirth Institute, Rayanne Madison Indigenous Full Spectrum Doula Training or Postpartum Doula Training, Doulas of North America or DONA. We've got the Taos Home Birth Midwifery Doula Training, Doula Trainings International, the Black Doula Inc. or Birthing Advocacy Doula Trainings, Health Connect One, Taylor Women United, Full Spectrum Doula Training, ICEA, and this one here down at the bottom, which is the Zagidi One Full Spectrum Indigenous Doula Training. So if you trained with any of these projects, you certified with them, all we need is a copy of your certification. So simple, right? Pathway number 2. So if you, for some reason, didn't take any of these doula trainings, but you did complete a different doula training, you can provide us with the information that your doula training met the following core competencies. So if your doula training included cultural knowledge or learnings on perinatal care, foundations on anatomy and physiology of pregnancy and childbirth and postpartum, non-medical comfort measures, support, and labor support techniques, lactation support, developing a community resource list, and then having you complete 3 services to doula clients. So again, if your doula training did not fall under any of the identified trainings listed in pathway 1, but you did complete another training that had these core competencies, and it was a minimum of 15 hours of training, you can still get certified. Let's go into pathway 3. So the third option for certification is what we're calling the experience pathway. So this is for any doula applicant who has experience providing doula services in either a traditional, cultural, professional, or volunteer capacity, but didn't go through any sort of approved provider training program that was listed in pathway 1, and who didn't complete any training or identified core competencies listed in pathway 2. So this one is specifically for our traditional birth workers, people who have been doing this kind of work for a really long time. We want to make sure that we are inclusive of all of this amazing wealth of experience that we have. So if your experience falls under pathway 3, we're going to ask that you provide 3 written testimonial letters or professional letters of recommendation using the testimonial templates that are provided by the New Mexico Department of Health on the following. So you have to have either a physician, a licensed behavioral health provider, a nurse practitioner, a nurse midwife, a licensed midwife, an enrolled doula, former client, or a community-based organization or elder provide you with this testimonial letter saying, yes, I know this person, they've provided doula services in these capacities. I trust that they have this knowledge to provide this kind of care. And we are asking for 3 of those testimonial letters. You will find the Pathway 3 testimonial letter template on our webpage. So you'll just download that and you'll have 3 people sign that and you'll turn that in with your application. It's important to note that at least one of those letters has to be from either a licensed provider or a certified doula. The other requirement is that we're asking applicants to provide attestation that they have provided services in the capacity of a doula to at least 3 clients sometime within the last 2 years. So, if a person's been providing doula services for the last 10 years, at least in the last 2, there should have been at least 3 clients. So those are your 3 options for certification. Again, Pathway 1, Pathway 2, or Pathway 3. When you submit your application, there will be a 60-day turnaround from the date of the application submittal. We estimate that we're probably going to get these out a lot quicker, but we are giving ourselves at least 60 days to kind of look through your application, make sure everything is, meeting the standards and the criteria, and then to turn around and, give you information that, yes, you've been approved for certification, or we might reach back out and say like, hey, we realize you might be missing some information here. We need you to provide us this information within a couple of weeks so that we can continue to process your application. It's important to know that the process to enroll with Medicaid and with each of the MCOs is a separate process. So those will fall outside of this 60-day time frame. They will have their own kind of criteria and credentialing and time frame. And those, will provide you with links in the toolkit on where to access that information. So again, a 60-day time frame to process your application. And we do want to kind of make a note here. So doulas who are applying for certification in this first phase between February 3rd and June 30th are going to have a 6-month certification period. So 6 months from the date that you are approved, after the initial 6 months, you will have to reapply for certification so that you can go through the background check. And I know that that takes a little bit of extra paperwork, and we do apologize about that, but we wanted to make sure that we are able to get you all working as quickly as possible and get reimbursed as quickly as possible. And so as we're kind of setting up the background check situation, we are going to just ask for your patience on this. So again, 6-month certification period for anyone who applies between now and June. So if you have some clients coming up who are going to be birthing between now and June, get your certification application in so that we can go ahead and get you reimbursed. And if you think that you might not be, having a client until after July, then maybe think about, when do you want to start your application period? But regardless, everyone is going to have to go through a background check. So again, any application who comes in after July 1st, 2025 is going to have a 2-year certification period. So even for those folks who are applying now, are going to get recertified, come August, September, you'll have a 2-year certification period after that. So you won't have to reapply for 2 years after July 1st. Sam, do you want to share anything about this?
Yes, part of our thought behind it is there is current legislation, and we don't know if a bill will pass, and if it does pass, what it'll look like. So what we're trying to do is what Jessica mentioned. There's going to be 3 phases. This is the first of the 3. The second phase, we are going to implement a more robust application that you can apply online, and then the third phase is to actually develop the full-blown program. hopefully by that time, we would know if the legislation is passed and what are the specifics of it. So it buys us some time so we can get you a better system to where an IT system where we can accept payments through an IT system, and then start actually getting the program documented based on what the decision of that pending legislation is.
Thanks, Sam. Per Medicaid requirements, CEUs are required for certification. So all doulas will have to complete 24 hours of continuing education in maternal, perinatal, or infant care every 2 years in order to recertify. So once you've gone through, you've submitted your application, you've gotten your approval letter, which says, yes, you're now, certified with the New Mexico Department of Health. You're going to move into the next phases to become a New Mexico Medicaid provider. So the steps towards reimbursement would then again include, the next step would be obtaining your NPI number, enrolling as a New Mexico Medicaid provider with the New Mexico Healthcare Authority. So we have some folks on the call who are from the New Mexico Healthcare Authority. Step 3 would be to credential and contract with the managed care organizations. And then finally, step 4 is to provide services, bill for services, and then receive reimbursement for services. And again, we have a toolkit on our website, which is going to walk you through all those steps towards certification. It includes links throughout the document where you can click, you can, take you directly to the identified HIPAA training that we've kind of picked out. It's going to take you to the healthcare authority where you would go to enroll as Medicaid provider. It's got all sorts of really great information in there, as well as our contact info and how to reach out to us if you have any questions throughout the process. And now we're going to just take some calls or some questions from you all. I know that there's a bunch of information coming through in the chat. And so rather than scanning through all of these questions, let's see. One of the questions we have is, I have an NPI number from Colorado Medicaid Doula process. Can I use this for the application too? My understanding is that this NPI is a national provider identification number, so it's the same. But Chrissy or April, please correct me if I am mistaken on that.
I would agree that in general, the NPI number can be used for New Mexico enrollment. There may be some additional caveats that we might want to talk through with the individuals as they work through that. But in general, the NPI should be applicable.
Thank you. I'm going to kind of go through some more of these questions in the chat, and then I see some folks raising their hands, so give me just 1 minute. When can I begin assisting clients after submitting my application? Do I have to wait until the application is processed? That's a great question. Yes, you do. You have to become fully enrolled as a New Mexico Medicaid provider before you're able to receive reimbursement for any services provided. So just to know, if you're already kind of seeing clients, those services don't count as far as reimbursement goes until you're fully enrolled. And again, Chrissy, if I'm saying anything that you want to chime in and share information about as well, please do so.
Jessica, just want to explain to that Department of Health is just the certifying that you have met the certain criteria to become a doula. That certification, once we will approve you with an approval letter, then you take that approval letter to Medicaid to become that provider, and then you go through that process. So it's 2 separate processes. What Jessica has been trying to do is get you prepared for also that secondary process. So Jessica will be processing the applications, reviewing it, and either approving it, asking more information on your application, or there's a potential denial depending on if her answers or her questions aren't answered within a certain period of time. But it's a secondary process that you would have to conduct at Medicaid.
Thank you, Sam. And some of these questions that are coming through definitely feel like they're Medicaid questions. And so some of them I might have to defer to Chrissy and the folks at Medicaid. One of the questions I'm seeing is, if this presentation is going to be available online. This presentation isn't going to be available online, but we do have a toolkit which actually provides more information, the step-by-step process. And so I would go to utilize that. That tool as an option. So again, that's on the NMDOH Doula Program webpage. There is, can you bill through a nonprofit or only through businesses? That feels like a Chrissy question. Chrissy, can I defer that question to you?
Can you repeat that question again?
Sure. Can you bill through a nonprofit, or is it only businesses that can bill?
So if there's a doula that would be a rendering provider for a business, and that business would need to be enrolled with Medicaid if they're not an independent doula. If anybody wants to talk through specific situations, I'm happy to do that.
Thank you. Okay, do folks need to have a current doula certification? Meaning if they trained many years ago, is this okay? Thanks for the question, Simran. So if you have trained in the past and you have been providing services, and those services fall within the last 2 years, you would be able to certify under Pathway 3. So let's say your doula certification, has expired, for example, and it expired, 5 years ago, and you're still providing services as a doula. As long as those 3, services fell within the 2-year time frame, and you were able to get the letters of, recommendation from your community folks, you would be able to certify under Pathway 3. Okay, let's see. There's a lot of questions, so give me 1 second. If we have an NPI number as a provider, like a community health worker, are we also able to use that? That feels like another Medicaid question. April or Chrissy, are you able to answer that? If folks have an NPI number as like a community health worker, do they also have to get an NPI number as a doula?
Yes, they will have to get an NPI as a doula.
Thank you. Okay, and we do have a link to get NPI numbers in our toolkit. Okay, so what did I say about referrals? So doula clients will have to get a referral from their primary healthcare practitioner, whether that's their doctor, their midwife, their nurse midwife, in order to get doula services. So you are required to get a referral for doula services if you're a Medicaid enrolled client. Will the CEU opportunities be provided through the New Mexico Department of Health? No, we will not be providing CEU opportunities through New Mexico Department of Health as far as I'm aware of. However, there are lots and lots of opportunities to get CEUs, and we will have more information about kind of recertification and CEUs as we get closer to that June 30th date. What are the reimbursement rates for Medicaid? That's the gold question. I will defer that also to our Medicaid folks, April or Chrissy.
Sure.
Yeah.
So the reimbursement rates, I'll put a little table in there because it's a little difficult to find, but they will be based off of the fee schedule. So I did put the supplement in the link into the chat box so that everybody has that for billing instructions, and there's also a link to the fee schedule in there. But I'll try to put a table because it's you'll have to do modifiers, and that will change whatever your rate is.
Do you have a general idea? I know that we had it to be billed within like 15-minute increments.
Yeah, so we stayed with all of that, and the limit is 9, and so we did all of that. What we did during the that's why I think it'll be easier if I just send a little table as a little cheat sheet. But the billing instructions are and the enrolling instructions are in the chat box in that supplement. But I'll attach a little table really quick. I think I can get it pretty quick so you guys can see the rates without having to go into the fee schedule. So you can see them pretty quick.
Okay. And I
Just
think
give me a
that
minute.
the flat birth fee or the fee for labor and delivery, I think it was $1,500 flat fee. Is that still? Not sure.
Sorry, I muted myself by accident. Yes, for the delivery, it is $1,500.
Okay, thank you. So as I said, we've had tons of like fantastic advocacy across the state. And I just want to give like a huge round of congratulations because we have a $1,500 flat rate fee for labor and delivery services. And then on top of that, there's going to be rates for doula services provided through visits, up to 9 visits per calendar year. So I just want to say, like across the country, like this is like phenomenal, and we're doing such great work in New Mexico here, really leading the way and giving doulas thriving wages and living wages for their work here. I am kind of going through, there are so many questions coming up in the chat. Let's see. I'm going to try and keep hitting them all up. If the referring provider transfers care to another provider, will the doula's reimbursement be affected? Does the referral have to be with who will be present at the birth? That's a good question. And then the question number 2 is, are the state requirements in addition to the chosen pathway requirements? Let's start with your first question, Kate. Chrissy, if a referring provider transfers to another provider, like let's say in the case of a home birth transfer, does that affect the doula's ability to provide care and get reimbursed?
So let me make sure I understand the question. So, sorry, this is April. So if, so the question is if the provider, the physician that you've gotten a referral from, or midwife, or whoever's going to do the birth, does it affect the doula services?
If they transfer care.
If they transfer, no, it shouldn't. They would just bill what they're normally billing. If they bill, a counseling visit, that's what they're going to bill. They're going to bill, whatever that is.
Okay. And as far as the flat rate birth fee goes, regardless of how long the birth is or how short the birth is, it's still the same fee, regardless of, the time frame of the birth. And then Kate Pultz, can you clarify question number 2 about the state requirements?
Yes, so there was a list of different requirements. For example, like the HIPAA training and everything like that. Is that in addition to whatever pathway?
Yes, it is. So everyone that is applying has to complete that initial list of criteria. And then in addition, you would choose which pathway you're going to go down, pathway 1, 2, or 3, and complete those requirements as well. And then we have a question for what would disqualify somebody from a background check? This is a great question for Sam. Sam, what would disqualify somebody from a background check? Doulas with nonviolent offenses, will they be affected?
I think that's going to be part of the third phase that, and I think the bill states that there'll be, we'll have to convene a committee to look at what kind of offenses and then make a decision based on what comes up on the background check. So I think we don't know yet. I can't give you a positive answer on that yet. As we build the program, we'll make sure that we do put it on the doula website of what potential. Yeah, and honestly, I think it'll be similar to what the Office of the Community Healthcare Workers are, where again we have a committee, we take a look at it, and then we make a decision based on it. And in some circumstances like that, if the offense is with the work that they do on a daily basis, but if it's a work that has nothing to do, if there's an offense that has nothing to do with what we do in healthcare, it can be considered, and we can make some exceptions based on that. But again, I don't want to talk out of turn because we need to wait for that bill, because that bill will actually be very specific on what we can and cannot certify. And then, but ultimately, it will not be one person making a decision. It'll be a group of individuals.
Thank you, Sam. Our next question is about the experience pathway. Is there a minimum amount of years of experience required? There isn't a minimum amount of years of experience required. However, at least 3 of the services have to take place within the last 2 years. So that's something to kind of note. And again, there will need to be some attestation from community folks who, will give a letter of recommendation saying that this person does have the experience to provide doula services. Will virtual services be covered for reimbursement? That feels like an HCA question. Chrissy or April, are virtual services covered for reimbursement under this benefit?
Would this be for the counseling? I mean, can I take that back for a minute and just kind of think about it, and I'll get back to you guys?
Absolutely, thank you. Yes. And I would say probably for counseling, but I think for myself, I'm even curious, if for some reason somebody needed virtual labor support, as in, it happened, we saw during the COVID pandemic. So that
we didn't state anything specific, in there, but I just like to take it back and make sure that what I say is correct. So I'll get back to you guys. Thank you.
Thank you. So we will provide the information to you all as we get more information from HCA. Okay, we have a lot of questions here. I'm so excited. There's still 22 questions plus to go. So thank you all for your patience and hanging in with us. And I hope that we're able to give you all the information that you need. Are we able to use CEUs that can apply to other certification rentals such as CLC and CHW? I think that for the recertification pieces, we'll have more information on that as well as we get a little bit closer to June. But Sam, maybe you have some thoughts about that as we're kind of starting this. Do you know if doulas are able to use the same CEUs that they're applying to other certifications?
I actually think that's depending on me and you, we can make that decision as we go along. So yeah, if you're comfortable with it, then we would be comfortable from the state. Yeah.
All right, well, I'm comfortable with it, but we'll get more back to you all as we kind of
we will definitely
get a little bit more information.
Just so you guys, just in general, we're trying to make it easy for everybody. We don't want duplicated work. We don't want duplicated effort. We want this program to be very successful, and we want as many people to be eligible for our certification and then eventually become for providers. So we are trying to make it as easy as possible.
Yes, absolutely. We want you all to get reimbursed. We're trying to make this work for you. Somebody asked again about the amount for billing. So if you scroll through the chat, Chrissy has put the table in the chat, so please go ahead and go there to get some more information about that. Okay. Let's see, what are the services that Medicaid will reimburse? How many hours for prenatal postpartum? Again, Jeff, that's a great question. I would go to, again, that chart that Chrissy put in the chat, or the fee service schedule will list out like the amount, the services, what they are, and the rates for that. How will that work for doulas, student doulas who are doing their hours? Can they get reimbursed for their services? So if you're a student doula, you would have to still kind of abide by the same criteria and qualifications as the other folks who are, you know, kind of going through one of three pathways. So if you've met the qualifications and the criteria to certify, then you would still, you know, you would be able to do that. But you have to be able to meet those criteria. So again, all of that's listed out in the toolkit. Okay. If doulas work in a team, how would that process work for billing? For example, say I do a prenatal, my partner does a prenatal, either of us might be the one to show up for the birth. So you would, from my understanding, and Chrissy and April, let me know if I'm saying this wrong, my understanding is you would bill for what services you provide. Does that sound right? Yes. Okay. So you bill for what you provide. So if you do the birth, you
Yes.
bill for the birth. Okay. Are these pathways up on the website? These pathways are, they're in your application. They're listed out in your application. They're also listed out in the toolkit. So you can find information both on the application and on the toolkit. When you're going to the online application, it's also going to list it out for you there. So there's all this information is kind of written out sort of redundantly, but we wanted you to have it in every way possible. Okay. For the organizations such as LCDF, are there any additional credentialing requirements as an organization? Alejandra, can you say a little bit more about your question?
I actually have to jump off to an interview, but I will reach out to you guys with some details.
Sounds great. Thank you.
Thank you.
Okay. Oh, here's a great question. If a person wants to do an unassisted birth at home, could Medicaid reimburse for non-medical doula support at home in this case? No medical providers present. That's definitely a Medicaid question. I think that, you know, I mean, as a doula trainer and somebody who's worked in this field for a long time, it gets very tricky when you're doing unassisted home births because it makes you the most knowledgeable person in the room, and it really starts to push that limit of scope where you might be moving from non-medical, you know, care to medical care pretty quickly. But I'm going to allow, let Chrissy and April answer that question.
Jessica, thank you for that segue and everything. And April, unless you have a response, I think this is probably something that we want to take back and bring back to the group.
Okay. Thank you. So we're going to make
I do know right now that if we did anything like that, we'd have to reissue the supplement or LOD, stuff like that, because it is not included. So right now, as it stands, that's not included.
Okay, thank you. So non-assisted home birth is not included under the doula benefit at this time. Okay, is there a Medicaid involved home visiting with ECECD and M? And how can a doula bill for that? Is there Medicaid involved home visiting? I'm not sure whose question that is, but can you ask your question with a little bit more information? Home visiting, ECD, New Mexico. Okay. I'm not quite sure about that question, so I'm going to keep moving forward, and then as we get to the end, if you don't feel like your question was answered, we can kind of revisit that one. Okay. Let's see. Or do they just need to add doulas? That might have been Alejandra who just left. Okay. Will doulas need to be bonded and insured independently to provide doula services? So do doulas need liability insurance or malpractice insurance? This is a great Medicaid question. Chrissy or April, do you want to answer that?
I think that we probably need to take that one back a little also.
Okay. And for folks on this call, what we're going to do is we can update our FAQ and just include these questions in it. So for those questions that, you know, we're not getting the answers right now for you, we will get it back. And, you know, this is like such a new thing that I just appreciate people's patience because we're all learning together here. Okay, so to clarify, the agency nonprofit would enroll with their own NPI and we would bill for the doula within the collective of the doulas and PIs. I think what we'll do, Simran, is I can connect you directly with Medicaid for questions around billing as a nonprofit. That way you can kind of get all of that information because I think it's probably going to be a little bit more than what we're able to just kind of fully get in this call together today. So I will get you connected with them. Okay, can I put the pathways on the screen back up? Absolutely. Let's see. So there's our pathways. Can you add additional titles to your NPI? You don't need another number. Sandra Jane, do you want to ask? Oh, you can add additional titles. Okay, thank you. You're letting folks know they can add additional titles to their NPI. Thanks, Sandra Jane. Sandra Jane has a doula and an IBCLC on theirs already. Awesome. So let's see. So we have the contact information for Medicaid in our toolkit. So you can go into the toolkit under the Part 2 Medicaid Reimbursement section. There is an email where you can email out to the Medicaid folks and ask your questions. Okay, is it 9 visits postpartum or 9 visits? So it's 9 visits in a calendar year. So 9 visits within a calendar year with a 2-hour time frame per visit, up to a 2-hour time frame per visit. So 9 visits up to 2 hours each per client in a calendar year. And then, yes, so Sam's sharing where you can find our content. Where do you recommend we go for an online HIPAA training? Great question, Sarah. So we have identified a very easy, simple to complete. I did it myself, takes about 20 minutes. HIPAA training. We've provided the link in our toolkit. You can complete that one. Or if you've taken a different HIPAA training or find a different HIPAA training that you want to take, you can take that one as well. So we've provided you a link for one that's easy and it's free for you to complete. Okay. If someone is a New Mexican resident but births in El Paso, are the services still covered by New Mexico Medicaid? Oh, that's a good question for Chrissy and April. So if they're a New Mexico resident, but they birth outside of New Mexico, are they still covered under the services?
As long as they are a New Mexico Medicaid enrolled recipient.
Okay.
And I would encourage to check the enrollment on a monthly basis if you're doing the birth option.
Awesome. Who will pay for background checks? The state. What kind of information will be required to keep in case of auditing, demographics, or service? We will get more information about background checks to you as we're able to, again, as we get a little bit closer to that June 30th deadline date. As far as information that is required to be kept in case of auditing, such as demographics or service, that is a question that you would connect with Medicaid about as well. And I would also connect with the New Mexico Doula Association because they've been building up their EMR system. And I think that they've got some really solid things to offer you all as far as, what you should start to keep as far as your own records go. Okay, attestation that they've provided services and the capacity of a doula. What is the question here? Let's see. This is what's stated. This is not what I just said. Okay. So for pathway 3, attestation that they've provided services in the capacity of a doula in either a paid or volunteer capacity for at least 2 years. The 2 years of that experience in the capacity of a doula must have occurred within the last 5 years from the date of the application submitted. So yes, within the last 5 years, but at least 3 of them have to happen within the last 2 years. Thank you, Sandra Jean. Okay, Sam is sharing information. Thank you all for your patience. Will doulas need a referral? Yes, doulas need a referral by a healthcare provider. Okay, Omni is asking that the application is requiring an FEIN number and a business license. Can we not just apply as individuals? No, in order to become Medicaid reimbursed, you have to have a legal business entity. So you do have to have a business license. You do have to have your certificate saying that you're a legal business entity. So definitely make sure you kind of get all those ducks in a row before you apply. If we've had a background check in the last 3 months, can that be used? I think that probably we're going to work within that time frame. I will have to get more information about background checks. We don't have that fully placed out, but that I think is something that we've been talking about. So again, we want to make this as easy as possible for you all. Oh, and there's Sam. Okay. Do we feel Medicaid in New Mexico is protected given the national landscape? Some of us contract through orgs that offer pro bono care to clients, but we will be unable to maintain our contracts with that org and also utilize Medicaid enrollment due to organizational policy. Oh, well. We want to clarify concern and potential job loss if Medicaid is threatened. So that's a great question. There is a lot happening in the landscape across the country regarding all sorts of stuff. And Chrissy or April, do you want to kind of share anything, or Sam, about this? Is New Mexico Medicaid protected, or doulas protected to provide these services?
I think that's a pretty big question, and I'd like to check in with my leadership and maybe bring back a statement to that.
Thank you. So FA, we will have more information on that as we, I think, know more as well, but we will share information as we get some from Medicaid. Sam is sharing our doula email. Have the MCOs agreed with the pathways, or will there be hiccups for folks who use pathway 3? We are meeting with the MCOs, the NMDA is meeting with the MCOs. Essentially, the pathways component is your certification. So that is through the New Mexico Department of Health, and that again is a separate thing than what the MCOs and Medicaid is going to be having you kind of meet the criteria and the guidelines. So it's possible that the MCOs are going to ask for additional information. I know that they're in the process of creating the toolkit. We are in conversations with them right now and advocating, but again, this is to be determined as far as what they are kind of taking on their own. Okay. How does the referral process work? Where do providers send the referral? Chrissy or April, can you answer that question?
Are you asking, do you submit it with a claim or anything like that? Is that,
Yeah.
I mean,
This is Kate. You have that question and another question under birthing options. Do you want to ask both of them together?
Yeah, so the requirement for a mom to receive doula support was that she needed a referral from her healthcare provider. As a provider, how do I go about giving that referral for these individuals? Where do I send it to? Do I give it to the doula? Do I give it to? Yeah.
so you as the provider, who do you get it from, or is this the doula who needs because the doula is the one that needs a referral?
Yeah. So if I'm the provider because I'm a licensed midwife,
Mhm.
where do I send my referral?
You send it to the doula. And the doula
Okay,
would
and then the
send it.
doula submits that with the claim, or
We didn't give instructions about where to send that they don't have to attach it to a claim, but they do have to have it in their record. And and you would have to have it in your record that, you did provide the service. So if we did an audit, we could find it.
okay, thank you.
Mhm.
And then there's a question if doulas are covered under the birthing option program.
So this program is separate. I mean, a midwife could be doing, under the birthing option program, they could be a midwife because those are midwives. And so they could be doing work together.
Awesome. There are, Simran, do you want to ask your questions about the nonprofit? I see like quite a few. You're kind of going back and forth with Chrissy in the chat. So do you have any further questions about nonprofits? I'm not sure if Simran's still here. Okay, Mariana, do you want to ask your question?
Yes, if I'm doing the same credential for being a counselor, and I do have an MPI as a counselor. So it's like, do I have the same MPI, or do I have two different things? Are these processes going parallel? Are they mixed? How that works?
So from my understanding, Sandra Jean says that you can add, you could add doula on to your NPI. So you could have an NPI that has like counselor and then also has you listed as a doula. So that would be a separate process, but you could do that through your NPI. To be credentialed as a doula through New Mexico Department of Health, it's its own kind of process. So you would have to go through our application process and complete like our criteria and certification pieces.
Okay.
Yeah, so that
So
would be
they're like parallel process. Like I have this billing from counseling and this billing from doula, even though I use the same MPI. Okay.
Yes. Yeah. Okay. We're kind of getting to the end here. As a postpartum doula, I provide overnight care that is often 6 to 8 hours in length. If I am understanding, the family would have 2 of those hours covered, and then I would have to bill them the remaining hours. That's a great question for April and Chrissy.
So so you're talking about the prenatal visit before, because you do have if it's part of the birth, then you would be doing the $1,500 one flat if you're sitting next to somebody for that type of counseling. Does that make sense? So for that full, like if they're in active birth and you're sitting, then you would bill the per diem rate, which would be the $1,500 for the labor.
I think the question is,
so you billing on top of that? Are you billing on top of that 2 hours?
I think the question is that this person is a postpartum doula and their visits are sometimes 6 to 8 hours in length because they do overnight stays and provide overnight care. So they're saying if they can bill Medicaid for the 2 hours that's allotted within that, time frame of a visit, do they then bill the client for the additional hours outside of that which is covered by Medicaid?
They cannot do that.
Okay. So I'm not.
We probably need to get some NMAC around that, but they can't bill the client if they're a Medicaid patient for
Okay.
other services that are, because this is covered, so they would have to do the 2 hours.
Okay. So so Doula Dana, it sounds like maybe having some more conversation around what that could look like for you as a postpartum doula. When applying for an NPI, what taxonomy code did doulas use? Great question. April or Chrissy, do you want to, if you have that taxonomy code, maybe we could just put it in the chat for all doulas.
The taxonomy code is in the supplement that I attached. If you just click on the link, the taxonomy is in there. And there's also billing directions and stuff. And then I sent a table. So they should have everything that they need as far as like, what's covered and what's not. I guess I would look a little bit closer at the previous question. I'm not sure that I quite understood it, but I also want to send this little caveat because it is in the supplement. And it says that if you have additional visits that require, so additional visits outside of whatever's billed here, that it would require documentation. So it does say that in the supplement. And will probably, if you build it, it's going to get denied and you're going to have to send the additional information. That's how it's going to end up happening, just so you know that the service will be denied if you do more than what you're supposed to. It will deny, and you can take that avenue, but you would have to provide information, and it will be reviewed manually, and a decision will be made on it, whether it's approved or not. Okay, so just so you know that it is in the supplement, something like that, if you wanted to do that kind of thing.
Thank you. Thanks for that clarification. Can we confirm where the HCA letter of direction is? Okay. Can we confirm where in the HCA letter of direction we can find information about the referral requirement? So the referral requirement is in the SPA, the SBA, which we have a link for on the website. So you can find that information, I think, kind of at the top of the state plan amendment. And then, so if you go there, you should be able to find that. That reminds me, can we bill the families for additional services if they opted in? So I think, Esperanza, this might kind of fall in the same line of questioning of what we just asked regarding, are you able to bill the families if they have additional things? And my understanding was no, you can't bill Medicaid clients for additional services. But I'm not sure if I'm misunderstanding your question. So if I did, please feel free to ask more. Are postpartum doulas covered in this billing? Yes, postpartum doulas are covered in this billing. So you have 9 total visits per calendar year. Those 9 visits can fall before the birth, after birth, kind of anywhere in between. So you can, sort of schedule ahead of time and think like, I'm going to put, 4 visits after, the birth, or if you just do postpartum doula work, you can just put all 9 visits after the birth if it falls within that calendar year. Okay, have the MCOs agreed? Let's see, have the MCOs agreed with the pathways or will they be here? I think we already kind of went through this. Jeff Flores, I appreciate you being patient. Do you want to ask your question out loud?
Yes, ma'am. Hello, all. 2 questions for clarification. If doulas are dual licensed, dual credentialed as CHWs, they can bill CHW services beyond the doula. I want clarification on that, if you don't mind. And number 2, with regards to billing families other services, we cannot bill. They cannot private pay, but Medicaid can be billed for other services to that family. I just need clarification on those 2.
Thank you. Chrissy and April, do you have an answer for those two? So question one was, can you provide services and bill for services both as a doula and a CHW at the same time for the same client? And then are you able to bill for the additional services under like a different hat?
That's correct.
For Jeff's first question in regards to duly licensed doulas and CHWs, I think that's permissible, but I'm going to say that documentation needs to be clear and separating between what the services were for doula and what was CHW, and the services would not be duplicated across both.
Mm-hmm. And then what I'm thinking might be really helpful is I know Medicaid has kind of their own list of FAQs for this. We can provide a link to that as it's kind of developed and put out, so that way all these questions are answered for you. Okay, so let's see. See when I lost your question. Let's see, where did it go? Oh, okay, wait, Caitlin Kelly. As a licensed massage therapist and a certified doula, I have an NPA for both of my certifications. Can I provide comfort touch postpartum, not as a licensed massage therapist, but as a full spectrum doula? This starts to fall like underneath the questions of scope, I think, a little bit, and like again, like what hats you're wearing. Some of these are great questions. I'm so glad Chrissy and April are here to answer them. Chrissy and April, can Caitlin provide comfort touch postpartum, not as a licensed massage therapist, but as a full spectrum doula?
So I think we've outlined what the scope is in our in the supplement. So what you provide should be within that scope. I understand that maybe doulas can do lots of other things, because I know that they can, do lots of other things, but it is limited to what is written in the supplement right now.
Awesome, thank you. I know one of the questions that we had received earlier this week was if doulas are, like, I'll give an example for myself. I live in Española. I live within Rio Arriba County, but I serve clients in Santa Fe, Taos, and Los Alamos. Do I need to have a license for Santa Fe, Taos, and Los Alamos, in addition to having a city license to work in Española, or do I just need a license for the county or the city that I'm living in?
So we're talking about the business license, right?
Yes, correct.
So as long as you have a business license, I believe you can, because you're going to be doing home births, so you could go over, right? You need to have a business license. So I guess we could take it back, but so we can ask a different department and just make sure I have this right. But I don't think it affects this.
Okay.
But we'll take it back and just make sure.
Okay, great. Okay, where can you find the supplement? You can find the supplement on our webpage. Okay, not required to have a business license where we live. Do we use our New Mexico tax number? Okay, as a follow-up to the license question, if we are not required to have a business license where we live, do we use our New Mexico tax number or EIN? Again, this is a question for Chrissy and April. Which we can get some more information on them on that. Okay. So I'm going to do this. I'm going to go ahead and just stop sharing so I can bring us all back into the room here. It sounds like we need a little bit more clarification on like the business licenses. We're going to get some more information about liability insurance, a little bit more information about non-assisted home births. Who do we have? Simone, I have your hand raised. Do you have a question?
Thank you. Thank you so much for just putting this together and bringing us all together. I had a couple comments and one question related to like the multiple hats we wear. So like a CHW and a doula, a lactation and a doula. One thing I have seen in private practice, just in other worlds, is if you're billing Medicaid specifically for two services on the same date, one of those services often gets denied. And so really kind of looking at that on the back end and how that's going to work for doulas, because I'm also a lactation counselor. And so I will see a client in the morning for something and then realize there's another issue, and, you know, a postpartum doula visit would be great but I may have to schedule that for the next date. And so on the back end, if you all could just take a look at that so that we don't get denied claims, just trying to help people, partially, and just knowing that, right, when you carry two licenses and two credentials and you're billing, just knowing that there's potential for denials if it's the same date of service. The second comment I had was, how will we know how many visits the client has accessed? Because, you know, for instance, if I just see someone for the birth or just postpartum, how will I know how many? Because I know education is going to fall in here too. So if they've already accessed, say, 2 prenatal visits, and then I see them for 6 without knowing, or 9 without knowing that they already had someone prenatally, I guess, are we relying on the client to know how many visits, or will there be a portal for us to access how many visits have been allocated?
So we don't have a portal for something like that, right? So, and I would, you know, we have the same issue across the board for all providers, you know. So if, you know, if they can't do 2 FSAT visits in a day, you know, and so those come up and we do see them. And so we, you know, you are kind of reliant on the patient to know what they're, you know, that they saw somebody today, or, you know, and that's unfortunate, and where they are. So this is probably a little bit more challenging because there are many providers, many doulas, many, you know, all actively taking care of one patient, you know, or could be. So we've run into the same issue with other things, and I don't think we have an easy fix for that. But we'll definitely put it on our radar to look and see if there was anything else, because I mean, we've run into the same problem with all the patients and services that were already provided, and the second person gets denied, second anesthesiologist gets denied. It just, you know, sorry.
Did that feel like that answered your question, Simone?
Yeah, I think just part of that relationship building, and probably should be included in like our intakes, right? Like, have you ever seen a doula before? Have you, right? Just kind of being able to delineate that. Thank you.
And I would say, you know, and in your intake forms, because like preconception counseling is covered under this benefit, just getting really clear, right? Like making sure it's not just that they think that they're being seen as, you know, for prenatal doula services, but you might even just check in to see if there's any sort of preconception support as well, because that would fall within that 9 visit kind of time frame. I think that I answered, is online CPR accepted? So if the CPR class that you certified is under the American Red Cross Association, or the other one that we have listed, and you have a certificate from it, it should be accepted, but it does have to be from those 2 organizations. Are there any other questions that you all have that you want to verbalize or that you want to put in the chat? I'm kind of scanning through to see if I see any raised hands. Does this feel exciting? Like, I'm excited. I'm so excited for it. It's been a long time in coming. Okay. Will virtual services be covered? Okay, so that was one of our questions that we were going to get back to you all on. So that will come in the FAQ for Medicaid. because that is to be determined, but it is on my list of questions to be answered. And then what is the permit? Sarah, do you want to clarify a little bit more about your question? What is the permit?
I was just starting to open the doula registry forum, and there's lots of places that we need to download different documentation. And I was just confused. Let's see, it says, yeah, it just says permit. And I didn't know, is that my DONA certification? Yeah, I don't know.
It kind of can you give me more information of like what it's falling under? Because there's this,
So let's see.
Is it like,
I'm sorry,
like,
it says upload local business license, upload tax certificate, and then there's one that says upload permit. And I just didn't know what the permit is.
The permit to conduct business within the city or the county that you are in.
Okay. Do you know how I obtain that?
So you should be able to obtain that through your local city. Gosh, I just lost the word. I know the Secretary of State has the section where they do have links for people to like go to their local county offices. So you should be able to access it through that.
Okay. I live in Durango, Colorado, but then we'll help people in the kind of Four Corners area. So where should I get that permit then, do you think?
I would go to your state's like Secretary of State, wherever you're like normally applying for your business licenses. And I would assume that they have some sort of link to that, or I would go to your local county office and they would probably be able to connect you with that.
Okay, thank you.
You're welcome. And I'm seeing Megan is asking the question, Chrissy, if they don't need a permit to conduct business, what do they do? I guess a local permit to conduct business.
So the local city or county is saying that we're not going to issue you a business license. Is that what I'm understanding the situation to be?
Megan, do you want to give a little bit more information?
As I understand it, and maybe I'm incorrect, but in where I live, I don't need like a business permit. I don't have a brick and mortar. There's, certain kinds of businesses need it, and then others do not. Like I do have a registration with the state, like a tax identification number. I have an LLC. So I have those things, but I mean, this seems like potentially this could be an extra step that not everyone needs to do. But I'm not sure.
Mm-hmm. One of the things that I have seen happen in the past where a business license is not issued where they reside, for example, an out-of-state provider, I have seen enrollment accept a denial letter or some kind of official communication from the office saying that we don't issue business licenses for that scenario.
So we would still have to go through the process of doing this even if we don't need it?
Well, Medicaid is asking for it. So I think that's something we just need to cross our T's and dot our I's.
Okay, thank you.
Mm-hmm.
You're welcome. Joy?
I think my question relates to Megan's. I am a certified birth doula, but I work with a doula co-op or organization, and so all of our billing is done, through our doula group. But do we then, as individual doulas, a part of this group, also all have to obtain our own business licenses? We work under the business license of our doula group, but do we all have to obtain our own to then be reimbursed if we are giving that doula care?
As individual doulas, you will still have to certify with the New Mexico Department of Health in order to become Medicaid reimbursed. So you would still have to meet the criteria and requirements to do that. And then the group that you're working with would bill, however they bill. That would be different, but you would still have to become enrolled as a provider in order to have billing under your services. Is that correct, Chrissy?
That is the way that I understand it, and we can look into that a little bit more just to confirm. Thank you for these questions.
So then it sounds like we all need to be our own private business owners to be able to be reimbursed by Medicaid. Is that what I'm understanding?
Let us research that more and confirm that for you.
Okay, thank you. And again, thank you to all of you for all the work you've been doing on this for so many years.
I'm just making notes of your questions here. Okay. Okay. Is there a registry for midwives referring to doulas, or recommendations for finding them? Also, where to find a list of other health services Medicaid covers, for example, or acupuncturist covered. So you can go to the Health Care Authority website to find out information about, what services are covered under Medicaid, kind of dig around there. As far as a registry for folks who want to refer to doulas, I know that in kind of the second and third phases of our program here at Department of Health, we will have a registry of doulas. That's not something that's currently available. I do know also that the New Mexico Doula Association has a fantastic listing of doulas across the state. So that would be, I think, where I personally would turn to if I was looking to refer somebody to a doula. I would go to the NMDA website. You can search by service. You can search by where the doula is located. And then you can kind of, refer based on that. So if you are a doula and you haven't, registered with the NMDA and gotten your services listed, I would definitely look at doing that. Sorry, somebody is mowing the lawn or something outside of my window. So I apologize for the background noise. Okay, wow, are there any other questions? I want to make sure that we get as many of them answered as possible here today, and I'm very aware that we're going to hang up this meeting and that there's going to be like 25 more questions that'll come our way, which is totally great, and we want them, but we want to answer them here if we're able to as well. Can prenatal yoga be reimbursed as part of a prenatal visit? So if you look again at the scope of practice that Chrissy shared in the chat, and maybe Chrissy, if you're able to, can you reshare that? So it's kind of coming to the top of our list here again, because there's been so many questions. You would look to see if that has fallen under, I believe it's under counseling services, right? Preconception counseling service, prenatal counseling. So kind of falling within that scope. Esperanza.
Hey, thank you for this, Jessica. This has been great. My question, and sorry if I missed this, is for those people who do, like myself, just postpartum, can one client have multiple doulas? Like somebody was there for labor, but I'm there for postpartum. Is that kind of thing allowed?
It is allowed. You just want to make sure that you kind of are still falling within that like 9 visit per year time frame. So if I would, let's say I was the birth doula, and then you came in for postpartum services, that would be fine. You're just billing for what you're providing.
Thank you.
Absolutely. I do want to say that on the application, there are some demographics that we ask. So like basic, contact information, address, email, things of that sort. Those are required. We do have a couple of questions about like race, sexual orientation, gender identity. Those questions do have optional sections where you can choose to answer or prefer not to answer. Just to know that. Let's see, Jimena, do you have a question? Oops, I lost Jimena.
Oh,
Oh, there you are.
yeah, sorry. Going back to what Esperanza asked, I know that she will be billing just for the services she provides, but the patient itself only has 9 visits. So if the other doula billed for like 3 prenatal visits, then Esperanza can only bill for 6. Is that correct?
That's correct. Yeah, that's correct. You're welcome. SB.
Yes, hi. So this is off of Jimenez and Esperanza's question though. So if they had a baby like in December and they took all the 9 appointments for prenatal, can they have another 9 postpartum?
That's a good question for Medicaid. Chrissy and April, are you still on this call, or Chris?
So the other question too that I can ask, going back to the license. So I live in Rio Rancho and my business is in Rio Rancho. What if I service people in Espanol or Santa Fe? Do I need to get a separate license to service them in those cities?
Yeah, that's one of the questions. We're going to get some information back for you.
Okay.
Yeah. So that's on my list of questions to get back on you.
Okay.
Yeah. Chris, do you have a question about the?
And then, oh, I'm sorry. And then there was going back to the CPR and the background check. We just recently had a program through UNM who did a background check on us. Can we use that background check, or is the state just wants their own?
We are yet to determine that. Again, we want to make it as easy as possible. So I don't want to speak out of turn, but we're going to try and work with folks. And as I get more information on that, I'll definitely let you know.
Awesome. Thank you.
Yeah.
Jessica, if I'm hearing the question correctly, it was so the birth ends up happening in the end of the year. And so the real question, and I think here is, do the number of visits start over with the new year? Is that SB with? Okay. I'm not going to say I know the answer, so I'm going to take that back and work with Chrissy and April on getting you guys an answer.
Awesome. Thank you.
Okay. I'm just writing this question down. So new benefit, lots of questions, lots of learning together. You know, we're all human here trying to figure it out. But we've got your questions, and so we'll get you your answers. Are there any other questions that you all have today for me? Everyone should be able to access the links on the webpage, access the applications. I am going to put my email. It's in, let's see, it's in the toolkit, but I'm also putting it here. Okay, so this is, oops, and I spelled it wrong. Don't use that one. Make sure I spell the name right. Okay, so use the second email. That's my email. I'm going to be the one that's going over your applications. So again, so sorry if I missed this. Will the answer to these questions come out via email or some other format? I think what we might do is we might see if we can get a PDF of frequently asked questions for Medicaid. And then as we get that, we will provide a link to that on our webpage. And then I have all your all's emails, so we'll go ahead and send that out through the email as well. Caitlin Kelly, do we have to mail them in? Can we email our applications? That's a good question. I think that what we're asking is that you mail them in, just because I don't want something to get lost in my email inbox and then, you know, we miss your application. So if you could follow the protocol of mailing it in if you want to use a paper application, that would be best. And then, yeah, are there any other questions today? If you think of a question, you know, if we didn't answer it and you like go on in the day and you're like, oh man, I should really ask this, please feel free to email me. I'm accessible, I'm around, and so excited for this benefit to roll out. So excited to get you all reimbursed. Again, thank you to all of our advocates. Thank you to all the folks behind the scenes who have worked so hard to get this going. And thank you to you all, amazing doulas who are doing this work day in and day out to support our families and help care for our birthing people. It's really amazing and just so appreciative. So thank you. I think we'll go ahead and end our meeting today. But again, if you have any questions, please feel free to reach out to me through email. And I look forward to reviewing your applications. Thanks, everyone.
Hey, Jessica, can I ask you a quick question? You may not have the answer, but do you know, I know that Abigail has retired or left the Department of Health and Midwifery. Do you know who the new person is that I need to contact?
Oh, yeah. As far as for midwifery goes?
Yes.
They have not hired somebody for that role yet.
Okay.
And so I think that there's a general number. I mean, the work's continuing, right? Somebody's still overseeing that.
Okay.
So the general number that you're calling and the email, it's still being answered by somebody.
Okay, so I'll just go online and find it.
Yeah, absolutely. You can just still
Okay.
contact. Yeah.
Great. Okay, I'll do that. Thank you so much. It was great.
Awesome. Thank you.
Jessica, I do have another question. This is Charlene. I may have missed it, and so if it's in the link or the questions, you can just let me know that. So I know you had mentioned that we have to be trained through like a certified program because I'm with Kappa, and I'm going to be getting my certifications with them here hopefully in February. Now, after that, we have to then go through the certification process through the state of New Mexico to bill. Is that the process?
You'll go through the state of New Mexico certification process to become a certified doula with us, which basically just means like we're just getting your credentials, right? We're getting your paperwork. You don't have to train with us or do anything. You're just turning in your paperwork so that we can, you know, show, yes, this person's kind of met all these requirements. We'll provide you with a letter of approval. And then you'll take that letter of approval to Medicaid and to the Medicaid portal, and you'll then enroll as a Medicaid provider.
Awesome. All right. Thank you so much for the clarification. I appreciate it.
Yeah, absolutely.
Thank you. Bye-bye.
Bye. Thank you. Thanks, everyone. Simran, yeah. Let me know if I need to connect you on a, do you need me to connect you with HCA?
Yeah, I think so. There might be other people who have this kind of like agency nonprofit situation. I wonder if we need like our own meeting or something.
Okay.
Just because it's so unique, but
yeah, that's a great, let me take that back.
I was assuming that we would just have our own MPI and then we would have them bill with, I mean, we would bill for them and then we'll have an administrative fee, something like that. But I'd love to work it out so that it's sort of seamless because it'll be different, you know?
Yeah, I'm thinking that it sounds almost, yeah. So yeah, we'll connect you and kind of put it out there to see if other folks want to join that meeting as well.
Thanks, Jessica. I'm so happy that you're at the helm. I just want to say it out loud. It's just like when I saw your name, I was like, praise the Lord. Here we go. We're in good hands.
Thank you. I'm excited. I feel really honored to be here. Yeah.
We'll see you soon. Thanks.
All right. Thanks, everyone. Okay, so hope everyone has a good afternoon, enjoys your day. Gonna go ahead and end today's presentation. Thank you.